background, little welcome.
I was thinking that it is always so quiet. And then I'm always like I could welcome to everyone that's joined since I said it. Thanks for being here. Feel free to introduce yourself in the chat and we like to land and share the intention for the meeting. And we will get started here just in a few minutes.
I can just work on my solo. I'll just start break out the ukulele.
Belt it out, Nicole.
I keep hearing threats about this ukulele. I have yet to see it surface.
You saw the ukulele. Mitchell, we can get your wife to we'll have her do the opening.
She probably would if we wanted her to.
There you go. Some fun facts sharing about Mitchell's life. You're welcome.
Okay, well, we'll go ahead and get started. I'm sure we'll see people continue to trickle in. But again, thank you all so much for being here. We're so excited to have this learning collaborative with you this morning. My name's Daniela Forrest, and I'm the Workforce Development Liaison here at Greater Health Now. And I have the great joy of helping the team to plan these learning collaboratives. And we are just so grateful to have this learning community and have you all be a part of it. So we this morning are covering the very, very exciting topic of the access to childcare. So we know that access to trusted, affordable childcare affects people's lives in so many ways, from their ability to attend important health appointments to their ability to participate in the workforce. So addressing this concern in our communities is a huge priority for us and really in line with our mission at Greater Health Now of advancing the health of our population. So we are so grateful to have our wonderful presenters here today to share with us about childcare access in our region. Greater Health Now is committed to being a neutral convener, and we're so grateful to be able to bring experts in their field to provide real-time information about these current topics. In the evolving landscape of healthcare, we are often learning alongside our audience and are unable to predict what the future will hold. We know that every organization's path is unique, and in no way are we recommending or endorsing a single pathway as it relates to this topic. Thank you again so much for being here today and engaging with us. So today we'll have 4 presentations, and over the course of this 2 hours, you should expect to learn some of the following things. So after this morning, you'll be able to describe the landscape of early learning in Washington State and the role of Department of Children, Youth, and Families in supporting childcare access. You'll understand the statewide business impact of childcare challenges. You'll learn about the innovative partnerships in our region that have led to successful childcare expansion projects. And hopefully you'll be able to take away some strategies for involvement in addressing this issue in your own community. So our agenda today will have Tracy Schreiber from Washington State Department of Children, Youth, and Families, and then Suzanne Suyama and Catalina Ramirez from Community Minded Enterprises, and they'll also be joined by Alicia Ruchert from Garfield County Public Health, then Mitchell Rhodes from Kittitas County Health Network, and finally Shane A. McGuire from Columbia County Public Hospital District. So with that, I'm pleased to share a bit more about our first presenter, Tracy. Tracy Schreiber is a community support specialist at the Department of Children, Youth, and Families. Tracy's role is within the Early Learning Division on the Access and Living Wage team, a team committed to expanding childcare access, supporting early learning facilities, and strengthening the early care and education workforce. So with that, Tracy, I invite you to share your screen as I end my share, and I will turn it over to you.
Thank you. Let me get my screens all set up. So you're seeing the slide. It looks right. Perfect. Cool. So thank you so much, Danny, for having me into Greater Health Now. As Dan mentioned, I'm the Community Support Specialist on the Access and Living Wage team at the Department of Children, Youth, and Families. My plan today is to introduce y'all to the statewide lens of early learning, talk about some of the known sector challenges, and to share our approach at the agency for tackling those challenges. Before we get started with the presentation, my colleague Jalix is going to drop a Mentimeter into the chat. We have a couple of questions right on the outset to get to know more about who's here today, and then we have some sprinkled throughout the presentation. So in full disclosure, we've had our own technical difficulties at the state with putting Mentimeter into the slide deck for easy access. And so we had to have a little bit of a workaround due to my own tech limitations. And so we can share the results at the end of the deck, but this was our workaround. We couldn't get it to incorporate yesterday. So my apologies on that up front. So the first question, I think it should be, I have a hard time monitoring all the things, slides, script, and chat, but it should be in the chat. There's a couple of questions right there that should be pretty easy. The size of your organization, and then, oops, the county that your business is located in. And that should just take a second. And I'll let Jalixa can also see the chat. So if there's issues, she can look at that while we keep going. So DCYF is a Washington State cabinet level agency that's focused on the well-being of children. Our vision is to ensure that all children in the state thrive physically, emotionally, and academically, and that they grow up safe and healthy. Our agency serves children and their families from birth through adolescence with a focus on early learning, prevention, and early intervention. So we are the lead state agency with duties and authority to regulate, create, and implement early learning programs and policy, with duties to increased access and capacity to high quality early care and education. And we have programs specific for income eligible children and their families that include Working Connections Childcare, which is state subsidy, and ECAP, which is our state preschool program. Our vision of early learning is to have an integrated mixed delivery system of affordable, high quality early care and education so that for all Washington's children, and to support child outcomes and school readiness and family well-being. And so this directly ties to our agency's strategic outcomes, and that is to be prepared for kindergarten and access across the state for every child. Oops, changing screens, and it's going too fast. We recognize that families want and need different options for care, and that's what we talk about as the mixed delivery system in the state. So one that can meet the needs of family and children and is available across settings. We know that care happens in a variety of settings that include family homes, childcare centers, outdoor nature-based programs, and schools. And our goal as an agency is to preserve parental choice of where a child receives early learning services, to streamline access to funding for this mixed delivery system, and to have programs that meet the needs of children and families. And so promoting a mixed delivery system improves access to the types of care families need and want, increases the early care and education's fiscal stability in the sector, and allows children to participate in programs that meet their needs. This slide is showing the number of children in our state and how many we anticipate need care. So it shows that there's approximately 1.2 million children that are ages birth through 12 in Washington. And of those, approximately 530,000, I'm just throwing out numbers at you, 530,000 are birth through 5. Licensed childcare in the blue, again, represents our family homes, our centers, our outdoor nature-based programs, and our school-age programs. Total licensed capacity in those programs can serve about 38% of the population under 5 and 30% of the population ages 5 through 12. To explain a little bit about the green, that's family, friend, and neighbor care. That's a form of, it's a type of care that's supported by state subsidy. And so there's over 2,000, we call them FFN, family, friend, and neighbor providers, with about twice as many children being served, about 5,000. And then the purple circle shows Washington state funded preschool data. Again, that's called ECAP. Transitional kindergarten data that's administered through OSPI, and Head Start data. Early learning providers participating in ECAP, again, state preschool, and who receive Working Connections childcare are required to participate in early achievers. So most states have a quality program, a quality rating program, and in Washington, that is called Early Achievers. You'll see it in different names in different states. Our Early Achievers program includes professional development, coaching, quality rating and improvement systems, evaluation and assessment effectiveness of childcare programs, and high quality standards. This program looks at the interactions with educators and with children and families, as well as learning environments that are made available for the children. This program also ensures that we see observable increases in childcare quality and that children are prepared for success in school. Over 3/4 of our childcare providers have an in-quality rating across the state, and this rating system is across a continuum. So from licensing all the way up through ECAP requirements that builds on the foundation for children, their caregivers, and their environment, and that's what's at the foundation of the house. And then alongside the house, we have provider supports. And then inside, we have the curriculum and child and family supports that all support a quality system. And this Early Achievers program works across our mixed delivery system, so family, home child cares, child care centers, and outdoor nature-based programs. We know that there are different variables that drive the cost of quality and the cost of care. In recent years, we've partnered with Washington STEM to develop a cost of quality care calculator. So we have two, one for family homes and one for centers. And what you see on the slide is a list of items that contribute to the cost of childcare or the cost of early care and education. So there are non-personnel costs, and those include things like fixed business costs such as rent, utilities, and supplies. These vary from geographic region. There's personnel costs, and this is the most significant driver of costs for childcare. So salary and benefit options for early care and education staff. And then there are quality enhancement costs, and these are program by program and include things like professional development supports, education materials, and curriculum, and other types of engagement with staff and families. So businesses are doing a lot to care for young children, and there's quite a bit that goes into ensuring that children have access to safe and enriching learning environments. So we're back to the mentee poll. I think Jalixa can drop it into the chat again if it's not already readily available. And so we do have a couple of questions for y'all about the lack of access to childcare impacting your business operations. It's Likert scale style, so you should be able to slide it 1 through 5, 1 being strongly disagree, 5 being strongly agree. And then the next question on the Mentimeter, once you finish that one, is a ranking. So you should be able to just drag and drop these in the order that you would perceive them as your interest. And so we are just doing a quick poll to do a check on interest related to childcare, which includes understanding childcare sector policy, facility development, support on or near site, drop-in care options, non-traditional hours, meaning outside the hours of 6 a.m. to 6 p.m., building relationships with local providers, or there's also an option if this is not applicable to you. I'm gonna keep going. Or I can give it a minute. I'll take a sip of coffee just in case people need a minute. And I'll also do a quick look at the chat because I can't do all the things simultaneously. Okay. Great. So as you likely know, childcare is not financed as a public good like elementary education and secondary education. So this means that individual families and childcare providers are carrying the responsibility to finance childcare. And we know that that's one of the biggest challenges in the state is the cost of care. Our state subsidy program supports kids and families with qualifying incomes. Right now, to be eligible for state subsidy, the maximum household income eligibility is 60% of the state median income. That equates to a family of 4 earning about $6,550 a month, or about $78,600 a year. The Fair Start for Kids Act passed in 2021 through the state legislature, and that did put Washington on the trajectory to support families with childcare subsidy earning up to 85% of the state's median income. That's based on legislative appropriation. Other known challenges include that subsidy rates reimbursed to childcare providers do not always cover the cost of quality care. We know that it's expensive to provide, that it's most expensive to provide care to infants and toddlers, and that the cost of care decreases as children age, and that we also still know that there's a lack of access across the state to childcare. So we're working towards a DCYF, again, to that goal of having an integrated mixed delivery system of affordable, high quality care for all children. And we are also working towards providers, early care and education providers, earning a living wage and benefits. And so to get there, we are building on that existing foundation, focused on ECAP entitlement and working connections childcare subsidy to strengthen our mixed delivery system. And our focus remains on child outcomes, school readiness, and the well-being and self-sufficiencies of families and the provider. This isn't necessarily new work, but with the recent investments in the sector and the impacts that we've seen throughout the pandemic, there's been a new emphasis on this work. And increasing affordable access to early care and education remains a primary focus of DCYF, and it does take both programmatic and legislative investment to get there. Our work is driven by a legislative proviso that was passed in 2023. And so it's a 10-year plan called the Access to Living Wage Proviso that's scalable based on investment by the legislature. The Access to Living Wages Plan's recommendations are categorized into 4 main goals: that families have care to meet their needs, that the early care and education workforce is thriving, that the systems are aligned across the mixed delivery system, and that there are adequate facilities to support access. These goals are a roadmap to ensure that we're working towards families paying no more than 7% of their family income for high quality care. And again, working towards the workforce receiving living wages and benefits. And so while the roadmap will help in achieving these goals, again, it's going to take time and investment to get there. We have to complement the roadmap, we have embarked on a facilities exploration project at the Department of Children, Youth, and Families. One of the primary objectives here is to deliver an analysis and recommendations for the development of an implementation plan related to technical assistance, startup supports, and other items identified focused on early care and education facilities to advance the access to living wage implementation plan. There are so many words that come all together. We're looking into early learning facilities research. We're reviewing how other states and municipalities have approached facilities retention and expansion. We're examining the interplay of state, regional, and local zoning and building code regulations, evaluating options for systematizing a process that would identify existing spaces. And we are also looking at how much it would cost to identify funding required to renovate and convert existing spaces. And so throughout this project or this process, we're engaging with parents, providers, other impacted parties, tribal nations, the business community to receive input on the development of recommendations for an actionable plan. If this is something y'all are interested in, please feel free to reach out. My email will be at the end of the presentation. And now I want to pivot a little bit to get into some of the data that we have at the state level. A little bit of an abrupt move here, but I wanted to make sure that we went over what we have available. I think Jalixa can put in the chat the access to the dashboards. This is one of our dashboards. This is what I did here was take a snip of Greater Health Now service area. A quick note on the slide, however, is that the data does not include information within the Yakima Nation. This In this slide, what I did when you go to play with it, as I've selected, ooh, I'm losing my notes on it. I've selected the county geography at all incomes, and I selected the need and supply data for infants and toddlers. It shows at that top line the Washington State program, so you can compare and contrast to the whole state, and then that bottom line over here at the top, the 2,910 number, is showing the service area numbers. And so across the service area, we see that there are about 5,000 children, which is 18% of the population. Ages 0 through 35 months. Half are served by programs. What that means is that the programs include things like ECAP, Working Connections, and Head Start. Total in care is the estimate of children in programs and the children who are paying via private pay. And then the uptake estimate is a percentage calculated by the number of children served in programs and private pay children divided by the selected population. So I think that at the end, or if you haven't already, you'll receive the deck. For reference, throughout the deck, I've included each county for Greater Health Now service area just for easy reference. So you can go to the dashboard and do it too, but I put them in for reference. This is a reference slide primarily that I can't talk too much about, but I wanted to make sure that you all had the data. So we don't keep transitional kindergarten data at the Department of Children, Youth, and Families. Again, that's through the Office of Public Instruction through OSPI. And that data is available on their website. And when the deck comes out, you'll be able to click that OSPI link and it will take you to the OSPI data for transitional kindergarten. But I didn't want to not include that just so that y'all can reference it. I wanted to give a quick overview of what our Extreme Childcare Access Desert data did show us. This one here is showing infants. Again, when you get the deck, I provided the different age groups so that you can look at them individually. But for reference to sort of talk through what this shows us is that as of October 2024, Washington State has 109 extreme childcare access deserts for non-school age children and 114 for school age children. The uptake percentages vary from 11.4%, 50.2% across counties, with the estimated need being met for non-school age children, and 3.8% to 29.2% for school age children. These access deserts overlap between the different age groups, so you'll see a lot of similarities, and they're primarily concentrated in the I-5 corridor. And so that's because those areas are more highly populated. With a high demand for childcare. And so rural areas also may qualify as access deserts, but what happens in the data set is that just the presence of one childcare provider in a rural area can significantly impact the designation because of the lower population density. The other thing to note about this is that these are zip code tabulation areas. This is a geographic product of the US Census Bureau. And that aligns zip codes with census tracts to create standardized geographic boundaries. An extreme access desert, in this case of this data, is defined as an area characterized by severely unmet need for childcare paired with a highly limited supply and surrounded by neighborhoods facing similar challenges. And then finally, my last data slide is the most recent poll of licensed programs by county, by Greater Health Now's area. It shows licensed providers for centers, family homes, school-age programs, and outdoor nature-based programs as of this month. And then finally, I have a couple more Mentimeter questions. These ones might be hard to read. You're about to hear some really awesome work that's happening in your specific region, and that's going to be super exciting. From the statewide perspective, we're looking to support the statewide system. So connecting the dots, elevating what's successful in one area of the state, and seeing where other geographies and communities can benefit from what's learned, essentially how the system's working together across the state. I'll say here that we know that the data doesn't tell the whole story of a community. When I showed you those maps, it's really hard to conceptualize based on those maps how a county like Garfield can not have any childcare that's licensed and not be considered an extreme access desert. And then as we look at those numbers in succession, the numbers don't tell the whole story. So we can see that counties across the region are differing in type and number of care options. And so that's, again, when we're looking to connect the dots as the agency, we don't have a lot of the details to fill in those gaps. And we know that the data does not tell us the whole story about childcare need in a community. And so our last question, I think I can change my slide that's up here, is the things that we can do as an agency as DCYF. So we're interested in building connections to learn more about community need and to support communities across the state as we're able, with things like information sharing and resource development and other creative ideas that you might be able to bring. And so that's that last question of the Mensa-meter. And that's what I have. Thank you so much. I can take questions, and I'm also open if I know that we want to keep moving. So if there might not be time for questions conversation, but
We definitely have time for a question or two. And I do see one in the chat. Tracy, I'll just read it. Regarding population density and extreme childcare districts, is there a way to do a rural county comparison only so that the data isn't as impacted?
that is a great question. And I will have to take that to our data team to see what our options are. That is outside of my scope of understanding. I will make sure that I capture it though.
Tracy, this was fantastic. I always love the data dump from you and all the information you give. But I would also just encourage the group, if Tracy's saying reach out to her and ask her more questions or get involved, please do so.
Yes, please do.
She's great with responding.
Stop my share.
And as Tracy indicated, these slides will be sent out in the next few days. And I believe, Tracy, that you included in the version that's going to go out some additional slides with
Yep.
county-specific information. So if you're interested in that, definitely check out that presentation when it comes your way. Okay, if there's no additional questions, we'll also pause at the end as time allows. If you think of something between now and then that you would like to ask Tracy or all of the presenters together, we will definitely have time, hopefully have a little bit of time for that right at the end. So, but I will go ahead and introduce our next group of presenters. Who are joining us from both community-minded enterprises and Garfield County Public Health. So Suzanne Suyama is an early learning director at Community-Minded Enterprises and has spent 30 years in the early learning field. Throughout her career, she has managed classroom operations, teams of early learning coaches, and has been involved in community coalitions and initiatives to strengthen the childcare and early learning systems. Having completed her master's project on employer support childcare, she is passionate about supporting communities and employers with childcare initiatives. Suzanne is joined by Catalina Ramirez, who is a family access coordinator with Community-Minded Enterprises, supporting coordinated recruitment and enrollment efforts across Central Washington. She collaborates with local partners, early learning providers, and state agencies to streamline access to quality early childhood programs for families. Her work focuses on increasing equitable access to childcare through outreach, community engagement, and data-informed advocacy. And finally joining them is Alicia. And Alicia Rocher is a childcare navigator for Garfield County Public Health District and also serves as the secretary to the board of directors for Pomeroy Community Connection. Alicia is passionate about supporting families in Garfield County and is honored to be a part of the work to bring quality, sustainable, licensed childcare back to her community. So with that, I will turn it over to Suzanne and team. And I believe I will continue to share my screen. Let me just orient myself and get these slides pulled up for you all. Okay, here we go. Okay, Suzanne and team, I will let you take it away. And just let
Okay.
me know when to advance the slides.
Well, thank you again for having us. We're excited to be here and share a bit about what community-minded enterprises and the Southeast Early Learning Coalition is doing to really dig into childcare access and availability. We have been surveying and doing some community listening sessions and digging into data, and we're just excited to share what we have learned. I'm also going to say I've already gotten locked out of Zoom twice today, so Catalina's giving me my backup. So if I freeze, she'll take over. All right, Danny, you can go ahead and move to the next one. Okay, so we really wanted to start this conversation with some pretty startling data around business impact of childcare challenges. This data was compiled by Ready Nation and Childcare Aware of Washington in a report that came out last summer that had these pretty startling numbers. 3,500 workers with children under age 6 quit their jobs, and many were fired due to childcare challenges. And all of us that are in business know that turnover relates to loss of revenue. So not only is this an issue that impacts families, it impacts communities, and it impacts employers. When childcare is unreliable or non-existent, you have employees that are not as focused on their work because they are worried about what is happening with their child in childcare. Oftentimes, there's absenteeism when childcare falls through, and there's some tardiness, some lateness. It's very impactful to businesses. So with that, we set out to have some community conversations around the impact that we're recognizing here locally. So you can go ahead and advance to the next slide. This kind of is an overarching view of what we found when we had our community listening sessions. So the Southeast Early Learning Coalition held 4 listening sessions as part of some grant activity in the fall of 2024. One was held in Pasco, one was held in Pomeroy, one was held in Walla Walla, and one was held in Clarkston. And really, the intent or the outcome really was to create a next steps plan around childcare access, availability, navigation, so that we had a kind of a starting point for next steps. And so I'm excited to report that we are, in fact, filling out grant application to implement these next steps. But I did want to really kind of highlight the 4 key things that rose to the top in all of the communities. After this presentation, Danny will send out the coalition report that summarizes these listening sessions, and there's going to be sheets that are real specific to each county. So if you want to kind of disaggregate the data and just really focus on one county, you'll be able to do that. But for the purposes of this presentation, we just summarized it all together. So not surprisingly, what rose to the top was families are struggling to find care. And, you know, we are in our service delivery area, has a lot of rural communities. So we know that there is not a lot of licensed childcare in rural communities. There's more availability in Yakima County and Franklin County and Benton County. But as Tracy pointed out, non-standard care hours, meaning before 6 in the morning, after 6 in the evening, and on weekends, and infant care is a challenge regardless of where you are at. The other thing that I really like to point out is Tracy did a good job of showing the 4 different types of childcare that families have a choice of selecting, right? There's family childcare, there's childcare centers, there's school-based childcare, and then there's the outdoor nature-based. So oftentimes, particularly for non-standard care hours, we find the bulk of those in family childcare. So it kind of takes away, I guess I would say, parent choice a lot of times when they're looking for non-standard care hours. The other thing that rose to the top is kind of what we just talked about, staff turnover, and when it comes to employers, like employers are feeling the negative consequences of families not having access to care. And then naturally, in all of these listening sessions, conversation turned to what could we do collectively? These listening sessions had families present, they had licensed childcare present, they had community leaders present, and they had elected officials present. And so naturally, discussion came about how can we come together and collectively put some effort in to ease this problem. We're not going to solve it. There's no quick solution, but how can we ease the burden on families? Okay, you can move to the next slide. This slide we threw in, and Tracy covered a lot of this just to kind of give everyone an idea of what the distribution of childcare programs looks like in our service delivery area. So that top pie chart, if you kind of hover over those thin slices, you'll see Whitman County up there. You'll see Asotin County. Garfield and Columbia County are not represented because either they have one or none licensed childcare. That's a problem for obvious reasons, but the other thing that I really like to point out is it's also an equity problem, right? Because Tracy talked about working childcare connections and ECAP, programs that families are eligible for, entitled to in our state, but they cannot access it because there is not enough slots or no slots at all. So anyway, I want to just really highlight that. The other thing that's interesting to point out is that top graph shows the total licensed programs. The bottom pie chart is the license capacity. So if you look at counties like Benton County and Franklin County together, Franklin County actually has more licensed programs, but fewer slots than Benton County does. And that just speaks to the different types of childcare. We see more licensed family childcare in Franklin County, more center-based programs in Benton County. Yakima County also is very heavy on licensed family childcare as well. Okay, you can move to the next slide.
I have a quick question on that particular slide. You said that tiny sliver is Whitman County, like the one we can like barely.
Yeah, there's a sliver. Yeah, right there, 11 providers.
Wow.
Whitman County is interesting because they are all center-based providers. So yeah, if you look at the number of slots compared to the number of programs, it's actually a little bit higher. But Whitman County has had a huge childcare shortage. Last year, I think they had a facility was damaged by weather, then they had to close, and another facility was church-based, and because of some other issues, they had to close, and it really put a big strain on that community.
Thank you.
Yeah. Okay, this talks more about, again, our summits that we held through the Early Learning Coalition. Then this is what we came up with as strategies. And again, this is summarized. So these are the things that bubbled to the top in all of the listening sessions, but in that packet, you'll be able to see specifics for each county. advocate for increased state and federal funding to raise provider wages. So Tracy touched on this and kind of spoke to why that is important. It links to quality, it links to access, it links to availability. Also, what can we do to develop some local funding models? So particularly for those counties, and Alicia's going to speak a little bit more to this later, I believe, but for those counties that do not have any childcare or very little childcare, what can they do as a county to kind of pull their resources, collectively work together to open up some licensed childcare slots? And then, of course, the employer supported piece, like what does the employers, what could the employer do? And I think it's important to point out that employers can support in many ways. It doesn't need to be opening up a licensed center in their property or, giving land for a facility. It could be simple things as accessing furniture that they don't need anymore that, they could give to licensed childcare to help with costs. It could be things like offering flexible spending accounts to their employees so that, tuition's a little more affordable. So, there are many things that employers can do that aren't on the full end of the spectrum of opening their own program. So we spoke to that as well. Okay, and you can move forward. And at this point, I'm going to move it over to Catalina, and she's going to talk about some surveys that we did for both providers and employers here recently. Oh, I guess Catalina got bumped out. I think we have a agency Zoom problem. Okay, so I'll keep going until Catalina gets back into this room. So in January 2025, CME, as part of a child care partnership grant through the Department of Commerce, set out to survey childcare providers to find out what challenges that they're facing. Specifically, we really wanted to learn about non-standard care hours because we know that we need more access to non-standard care hours. So what were the barriers in providing that care, and what are community supports that could help in that? So we had about 100 people respond to this survey, 100 different programs. Again, this is just Benton and Franklin counties. And we did note that 61% of the providers took the survey in Spanish. So we just wanted to make sure that it was accessible to all licensed childcare providers in our community. So the top challenges were inadequate space to serve more children, and marketing and outreach gaps. In Franklin County in particular, we have a pocket of providers in Pasco that is very concentrated to the point where we need to figure out how we can better move families to open slots in those areas. Which is why marketing and outreach jumped onto that list. And we have what we hope is a great solution for that. Catalina's going to talk more about that later. And then when they say limited support for serving non-standard hours, meaning we know from the previous slide that a lot of Franklin County providers are family child care. So they have little to no other employees. So obviously we do not want somebody working many, many, many hours, especially when they're working with children. So that's a lot of what the limited support is. And of course, to help with those identified challenges, they listed facility expansion support, employer partnerships, and better compensation for weekend and evening care. So there is what's called a non-standard care bonus that they get through the state for children and families that are receiving Working Connections child care. So it's minimal, but that would be an incentive if that were raised. Okay, you can move on to the employer survey, and it looks like Catalina's back, so I will pass it to her.
I apologize. Our system, I have no idea what goes on with Zoom. But moving on, we did conduct a employer survey back in June or this year. But from the employer side, our June survey showed that 11 out of 16 employees said childcare issues are directly impacting their workforce. And the top issues flagged were cost of care for their employees, lack of infant care, and no childcare options during shift hours, such as 7 a.m. to 5 p.m. or later. The good news, many employers did say they're open to working with providers, possibly offering a space or supporting shared models. And there's definitely an opportunity here for the public-private partnerships to do so. Go ahead and next slide, Danny, please. And so to help bridge the gap between families and providers, we've partnered with Kinside, which is a child care navigation platform. And the way it works is that employers are able to offer Kinside as a free benefit, as a resource to their employees. And employees are able to use the platform to find licensed child care providers and see real-time openings and are able to join wait lists or even schedule tours. They are also able to chat with the providers directly through the platform, and providers benefit as well in this platform because they can fill their slots faster and cut down on time spent managing inquiries. So ultimately, this leads to lower absenteeism and higher retention, and helps businesses stay competitive in a tight labor market that we are in today. Go ahead, next slide. So all this is supported by a growing effort that we've launched, a child care strategy committee based in the Tri-City area. So far, our work has mainly focused on Benton and Franklin counties, but we know that the rural areas need just as much attention, if not more. So that's why we're now expanding this effort to include Columbia, Garfield, Whitman, and Asotin counties, and inviting leaders to join us and cross-sector with each other. At this point, I would like to turn it over to Alicia, who's been leading some incredible work in these rural communities. She's going to share more about the unique challenges and the progress happening in the ground in those counties as well, and how local voices are shaping the solutions.
Thank you, Catalina. Good morning. My name is Alicia Ruckert. I am the Child Care Navigator for Garfield County Public Health District in Pomeroy, Washington. It's an honor to join the Learning Collaborative this morning. Thank you, Danny and Suzanne, for inviting me to share a little bit about the child care story in Garfield County. So childcare was identified as one of the top 3 needs in our community through a community health assessment, which was done in 2023. As a result of that, a committee of community leaders formed to address the issue. That committee was comprised of people who had regular day jobs, and they felt it was important to have someone focusing solely on creating a pathway to quality, sustainable, licensed childcare, which does not currently exist in Pomeroy. So they created the Child Care Navigator position. and that is funded through Garfield County Public Health. I was blessed to be hired to do that work. So since April last year, when I came on board, our group has created a nonprofit organization that will oversee our future childcare facility and hopefully expand to assisting or being an umbrella organization for other support work in the community for youth, kind of a cradle to career model. We also received a donation of property and a building for our future childcare facility. We secured a Department of Commerce planning grant. We're currently working with Department of Commerce in the Childcare Community Partnership Grant. We're going to be focusing on workforce development, recruitment, and employment activities. And we through the planning grant, we have a really great floor plan and design for our future childcare facility. So when the Early Learning Facilities Grant opens on September 1, we have a shovel-ready project that we're ready to apply for funding. So we're very excited about that. So Suzanne referenced some of the work that SEELC did in the Southeast Washington counties. Through that, we saw clearly that the communities around us were going through similar childcare crises, and we're all in that childcare desert, and that those communities were undertaking similar efforts to meet those crises. At the summit that was held in Pomeroy last fall, the data represented very clearly showed similar childcare trends in our neighboring communities. Martha Landman is our administrator for the Public Health District in Garfield County, and she's also my supervisor and my partner. And we had visited already 3 communities and facilities, and just coupled with the work that SEELC did, we realized there would be great value in collaboration with these existing projects and some others that we learned about. As the saying goes, y'all, there's no sense in reinventing the wheel. Because our communities have very similar demographics, we're either falling under the frontier or rural designations. Our stories and our projects are also very similar, although we have learned that each community has its own unique approach and vision, and that's really exciting. So there's a wide variety of things going on to help inform the work that we're all doing. So what we did was reach out to 5 communities spanning 4 counties and 2 states. And we convened our first meeting of the Southeast Washington Regional Child Care Network in Dayton, because that's a centrally located community, on the 17th of June. The attendees are all involved in child care development at some level in their respective communities, ranging from just the planning, talking stages to operational child care facilities. Communities represented were Pendleton, Oregon, Prescott, Waitsburg, Dayton, Pomeroy, and Colfax. So at our first kickoff meeting, we heard each other's community stories. We heard the status of everyone's projects, their successes and their challenges, the resources they were utilizing, which was super helpful. And we talked about what the future for the network might look like. And during that time, we also became aware that there was a lot of stress related to developing these projects. And our time together was kind of an opportunity for each of the attendees to vent in a friendly environment, sharing their frustrations and concerns and feeling supported in that space. Just everyone having common experiences and able to support each other working through those. 2 of our attendees are actually involved in childcare centers that are currently in operation. And they brought such helpful perspective to the table. It was such a good meeting in so many ways. And the group saw the value in continuing our meetings online on a quarterly basis. Currently, we don't have a formal framework with a vision or mission or goals defined, but those things will likely become apparent as we continue to meet. For now, the value is in the network itself, what we can lend to each other and how we support the work of filling in this childcare desert that Tracy referred to and showed the map of, because that's what our communities need. And if any of you are interested in more information or becoming a part of the network and sharing in the work, just let me know.
Thank you, Alicia.
Mhm.
Danny, you can go ahead and turn the slide over. Awesome. And just to wrap up, if you are looking for a way to get involved and would like to join us, the Child Care Strategy Committee meets monthly, and you're always welcome. We love new voices from employers, healthcare, um, government, community organizations, and whether you can offer ideas, space, partnerships, or simply want to listen in, we do want to hear from you. So there is that QR code there, and it just asks a couple questions where we can send an email link to you and whatnot. And please reach out if you'd like to be added to our group or want to learn more about it. I think together we can build stronger systems that support the families, the providers, and our regional workforce. And that is it. Thank you.
Thank you so much. Does anyone have any questions for community-minded enterprises and Alicia? We do have a minute or two for any questions.
That was fantastic. Thank you. I love hearing about how communities come together. Like, hey, we have this issue to address, and was like, let's chat about it. Let's figure out a solution. So I love seeing how the needs assessment actually it can drive into building a coalition and drawing to solutions. So I love hearing about it. Thank you. It warms my heart.
I have a question. I was wondering if Alicia could go into more detail about how she got her building.
Yes, absolutely. It's one of our sources of pride, a little jewel in our crown. So early on with the committee that was formed to address the childcare issue, we just started brainstorming possible places in the community, possible properties. As you can imagine, there's not a whole lot of existing buildings in Pomeroy that could be utilized. So we made a short list, and among those was the local funeral home that was it was underutilized at the time. It's still underutilized. And we kind of caught wind that the people that owned the building might be looking to um, either sell or donate the building for a different community use. They were using it maybe once a year, as they have a facility in Clarkston 30 miles away, and most people would go to the Clarkston facility rather than go to the Pomeroy one. They weren't staffing the Pomeroy facility anymore. So we just partnered with Inovia and approached the owners of the facility and sat down with them and told them what we were hoping to do to create a future childcare facility in Pomeroy, and they were completely on board. They felt like the building would be a fantastic fit, and it is. It's one level, 4,000 square feet. It has so much space and just lends itself nicely to being a childcare facility. Inovia helped kind of facilitate the transfer of ownership from the private owner to our nonprofit organization. That kind of took some time because we did not receive our letter of designation from the IRS until February, and we'd started the process in September. So but I mean, all things considered, 4 months isn't all that bad. So now we own a building. It's been cleaned out, and we have a beautiful design and floor plan for it. and hoping that Commerce sees the value in partnering with us to renovate that space. We think it's a very interesting story because it's sort of come full circle where this building was used for the celebration of end of life. Now we get to use this building as a celebration for the beginning of life with bringing our infants and toddlers and preschoolers and school age kids in to be well cared for in our community.
Thank you.
Yeah.
That is just wonderful and so exciting for the future of that project. We will all stay tuned and root you all on. And thank you, Suzanne, Catalina, and Alicia, so much for being here today and sharing. We are so grateful. And with that, we will hear about another very exciting and inspiring project up in Kittitas County. So I'm thrilled to have the chance to introduce you to Mitchell Rhodes. After earning a PhD in human development at Utah State University, Mitchell returned to his home county of Kittitas to work in social services. From 2019 to 2024, Mitchell was the grant writer for Kittitas Valley Healthcare and worked with community partners, including the Kittitas County Health Network, and brought in over $8 million in funding to Kittitas County to help improve the rural community. In 2024, Mitchell was hired as the executive director of the Kittitas County Health Network and continues to work to improve the health of Kittitas County residents through various initiatives, programs, and outreach. So with that, I'll turn it over to you, Mitchell.
Hello, everyone. I'm excited to be here and talk about some really exciting work that we've done here in our county and the amazing partnerships that we've built. I I think one of the biggest things that I want to emphasize is that this was a huge partnership between multiple organizations, and this is it's not possible without that partnership. So let's go ahead and go on to the next slide. So I wouldn't be doing my job as the executive director of the Health Network to not tell you guys who we are and what we do. So we are a rural health network, and we are a nonprofit with a mission to advocate for whole person health through community collaborations and connections to resources. Our vision is that all people in our county are supported in achieving health and well-being, whatever that is to them. We, similar to Greater Health Now, we are the conveners in our community, and we bring in community partners to participate in work groups, and we have over 60 partners that come in and collaborate with us on different initiatives and programs and projects. All right, so let's actually start talking about childcare. So next slide, please. So as the health network, our role is to take on the community health improvement plan. And in the latest iteration from 2022, and this was also started in, before that in 2020, the priority areas are access to healthcare, behavioral health, and children, youth, and families. And in 2020, KCHN received a grant from the Washington State Department of Commerce to complete a needs assessment to create a strategic plan surrounding childcare and then to implement that work. Let's go ahead to the next slide. I'm probably going to move pretty fast. If I need to slow down, please tell me. Okay. So this is really high level of what that needs assessment told us. And I'm really going to focus on two separate pieces of this pie. The first one is funding. So we knew that in our county, so in 2020, Kittitas County was the third fastest growing county in the state of Washington. Which brought in a large surplus of children, and which was impacting our schools, our child cares, and we knew that there was something that we need to focus on. And we knew that childcare was a priority area that we needed to look at. And in the needs assessment, we found that funding was a really huge barrier into expanding childcare in our community. A lot of that came down to operating costs of childcare, the salaries, the keeping the doors open, those kinds of fun things. And then on top of that, the cost of licensing, going through that whole process, the cost of building was increasing. And so it was a huge barrier for any of our childcare centers in Kittitas County to trying to expand or build new or to open a new center. And then on top of that, at the time in 2020, our county was a childcare desert. For every one child in our county looking for care, or for every one slot, sorry, I get this back mixed up in my head all the time. For every one slot of childcare in our county, there were 4 children in need of care. And so it was extremely difficult to get a child into care. And this lack of access to childcare was really impacting employers in our community. And we were having candidates looking for jobs coming here. They were excellent candidates, deciding not to take jobs because they could not have get access to childcare. So next slide, please. So we knew there was a problem. We knew that there was a huge gap that we needed to fill. And so what do we do? So at the time, Nicole Matthews, who works at Great Health now, hey Nicole, was working here at GHN, and it was her role to bring partners in the community together to complete the needs assessment, to create the strategic plan, and to come up with the next steps in order to address childcare in our community. And one of those things that we needed was a champion. We needed someone to say, we're going to step up, we're going to take on the role of expanding childcare. And Missy and Logan Denlinger from Happy Feet Academy were the ones who said, we'll do it. We'll do whatever we need to help expand childcare. But in order to do that, they needed funding, they needed partnerships. And so that's where KVH comes in. And in my role at KVH at the time, I was the grant writer. I took on the lead of helping facilitate finding and applying for funding with Happy Feet. So in 2021, when we were starting this project, KVH was one of the employers in our county. They're the second largest employer in our county, who was experiencing a recruitment and retainment issue with employees. We had nurses and doctors who were either leaving or not coming to our county because they didn't have access to childcare. And so seeing that issue and seeing how it was getting even worse through the COVID-19 pandemic, KVH stood up with Happy Feet and said, we'll partner and we'll do this. So they developed a really close partnership to address childcare in our community. And so let's go to the next slide and we'll start talking about how that partnership happened and what we did. So we knew we had a partnership. We knew we had a champion. We knew that we needed to expand childcare. And we had a great team that was built through these partnerships. And so we identified that there were a lot of barriers into expanding and addressing childcare in our community. So one of them, like I said, was funding. It was really expensive to build new. It was really expensive to purchase property. And then on top of that, our county had a zoning issue where the areas that we could put in a childcare was extremely limited. And when we were looking at properties, at the time, there were only 4 properties available. 2 immediately went off the market, and 1 was not viable for what we needed. And so it came down to 1 property available in our county that could help us expand childcare. So we identified the Early Learning Facilities Fund through the Department of Commerce as a way to expand childcare to build a new center. So Happy Feet took on that application. I assisted in completing it and writing the grant itself. And in helping do that, KVH put in my staff time. And they also put in a contribution financially. They did a 25% match to the grant to help purchase the land and to start moving things forward. And then as our other partner, KCHN, continued to collaborate with us and to facilitate meetings, and also took the lead on addressing the zoning issues in our county. So let's go to the next slide. So as I said, there was a huge zoning issue where the number of properties available was extremely limited down to literally one property. So KCHN started meeting with county representatives to talk about the impacts that the zoning restrictions were having on childcare expansion. And through those conversations, through that partnership that KCHN developed with the county, they then took the proposed changes, amendments to the county commissioners, and they implemented those changes. So zoning was no longer as big of a barrier in our county, which was really exciting. So let's go to the next slide. So while we were working through the zoning issues, KCHN was doing that side. KVH and Happy Feet applied for the ELF grant, and we were awarded. Super exciting. We got $1 million from Commerce. It had some challenges with it. So there was a LEED silver requirement, so it had to be energy efficient. There was a lot of issues with that. The cost of building had increased significantly from the time we submitted the grant until the time we were awarded. And we needed a lender to help complete the funding for the build. And there was the first lender offered a really high interest rate, which was not going to be something that could be affordable for Happy Feet. So we were real excited. We got this $1 million grant. There's still some barriers, so let's go to the next slide. So, like I said, we got $1 million, super exciting. The project itself was going to cost about $3.7 million to complete between the purchase of the land through the build. And so it wasn't enough money. We had $1 million, super, super cool. Sounds like a lot. It doesn't go very far. So KVH provided a match of $250,000, and in return, Happy Feet provided first right of refusal for KVH staff to get into childcare. The Happy Feet and KVH worked together to also approach the county with KCHN to get some ARPA funds to help with the build, and we received $500,000 from the county. We also worked with the city to reduce some of the costs and getting traffic impact fees exemptions, and it was a total of about $250,000. And through all these things and getting a lender and all that, we finally had enough money to expand childcare in our county. So let's go to the next slide. This is really getting down to the nitty-gritty of what we did. So in 2023, we were able to break ground on the Child Care Center. I don't remember exact square footage, but it's about 8,000 square feet. And it increased childcare slots in our county by 112. And 50% of those slots were reserved for low-income families who utilize subsidies. Happy Feet and KVH continued to partner and to provide that first right refusal to expand healthcare providers in our county. And the property that they were able to purchase has the opportunity for continued expansion and add another center if they need to at some point in the future. And so we went through all that. Go ahead and go to the next slide. You're doing great. We went through all that, and we were happy to report that in 2024, we were able to open the Child Care Center. And at the time it was opened, it was full and ready to go. It has 2 new infant classrooms, 2 preschool rooms, and 3 toddler rooms, I believe. I don't Don't quote me on that though. And it is in full operation today, and it's very, very exciting that we were able to do this. So let's go to the next slide. Let's talk some key takeaways of how we were able to do this. And I think I talked way too fast, and I apologize. So expanding childcare in our county, because we are rural, and because of the cost and everything, it would not have been possible without having diverse partnerships. As you saw throughout this whole story, we brought in nonprofits, a private and public partnership through the hospital district, through the county, through the city. We brought in the state and other funders to help this happen. And we had a really strong commitment, not only between Happy Feet and through all the other partners, but it was really just a commitment in our county to expand childcare for the needs that we need. And KCHN was really big in advocating and educating what the community needs were and how the county officials could make this happen. It was relying on the data. We had the assessment. We had everything that we need to know that this needed to expand. And funding is always going to be a huge issue because Kittitas County is expanding so quickly. It's very expensive here. So we know that funding is going to continue to be an issue, but in diversifying those funds and finding different ways to bring in funding, we were able to accomplish a really big project. And it also wouldn't have been possible without local buy-in. I mean, we had data from parents, we had data from providers, employers. We knew that people were interested and excited, and there were a lot of people fighting to make this project go. And it's really important when you're trying to get this kind of project off the ground is to just start somewhere. And that's where KCHN really started in this project, was we know there's a need. Let's get people together and find where we can find some common ground and get going. All right, next slide. So if you have any more questions, please feel free to ask me here, or you can email me. I'm excited about this. Nicole and Amanda both know a lot about this project too, because they were both here fighting along with me. So are there any questions for me?
I just want to say thank you to you, Mitchell. And as Mitchell mentioned, I had the opportunity to lead this effort with him as a chief HR officer. And so I just thought this was such a rewarding experience for me and my professional experience. And although the ground of the new center did not break until 2024, we had the opportunity to have that partnership with Happy Feet for increased access to healthcare workers prior to that. So that was an ongoing partnership. We used to get regular reports on how many people were able to get access due to this partnership. And so again, an innovative approach, many people involved in Kittitas County. It's an amazing county for collaboration, and but those benefits started right away, and I was able to see that firsthand. And we have one of my previous team members, Heather, on the call as well, who's now working that into her recruitment offerings and package. And it was a really significant partnership. So thank you, Mitchell, for your hard work in multiple organizations making this happen, and for your partnership. I will also add the CEO at the time, Julie Peterson, who was also on our board at Greater Health Now, was a huge leader in this effort as well, very passionate about this topic in the community. And today is her birthday too, so she would be very happy that we're having this conversation in her honor. So
Of course, I can't not say anything. Yes, this was fantastic, and I really just appreciate the call out on collaboration. And if you guys saw that timeline, it took a very long time. It took years, so it took a lot of commitment. There was a barrier around every corner, and without having those key partnerships in place and people we can call upon to help, this wouldn't have happened. So I'm super proud of all the contributors. I've had several times calling Tracy over at DCYF. We're calling our friends at Commerce. We're calling the county, the city, KVH plenty. This took a huge commitment. So I'm very proud of this work for community coming together. So great job.
Phenomenal. Well, thank you so much, Mitchell. We really appreciate hearing about this project. As you all heard, this project is very near and dear to our hearts here at Greater Health Now, and we're just so excited to share. And I love seeing sort of the thread that we're weaving today, talking about DCYF and the data that they can share to help you see the need in your community, and community-minded enterprises coming in to pull the community together and start to have these conversations. And Alicia, as I'm thinking about you with your brand new beautiful building, I hope you'll have some great takeaways from both this presentation and our next presentation, where we'll talk about another project in Columbia County. So I am so pleased to introduce Shane to you all. So Shane McGuire serves as Chief Executive Officer of Columbia County Health System. An innovative leader, he was recognized as a 2017 Community Star by the National Organization of State Offices of Rural Health. Shane holds a Master of Health Administration degree from the University of Washington and has been with Columbia County Public Hospital District since 2010, assuming the CEO role in 2015. So Shane, I will go ahead and turn it over to you.
Thank you so much. Thank you for having me here. It's been amazing seeing the previous presentations and all the overlap in between our projects. We may have, gotten to our end result a little differently from one another, but they all stem from the same challenges and access to care. So appreciate this opportunity to talk about our story here, our journey. So this first slide, sort of talking about the community's challenges around childcare. There were challenges prior to 2020 with access to care. COVID actually made those challenges even worse. Go ahead, next slide. A little bit about us as an organization. We're a public hospital district, so we're a municipal organization. Our community members do tax their houses and property to help support healthcare in the community, but we're also a critical access hospital, and so we fall under critical access hospital designation. We do have a couple of mission and vision statements that align really well with childcare. Timely solutions and devotion to our region are the two that stand out on mission. And then person-centered care without boundaries or limits. And I think that's really important to keep mindful of as we're looking at this, because I've come to learn that childcare is healthcare. It's not just economic resource, although it is an economic resource. It helps stimulate your economies. There are a lot of supporting details that say that children who participate in a high quality early childhood learning programs actually have better health outcomes over a lifetime. And so, kind of keep that in mind as we go through. Next slide, please. So in 2020, the last two remaining childcare providers ceased operations in the community. We started recognizing that our nurses were having to call off shift more. The schools during COVID were closed intermittently, and it was really impacting our ability to care for our residents because our workforce was impacted. That really sort of keyed up our sort of alarmist mentality about childcare in our community and how important it was to delivering healthcare. We did participate in a feasibility study in 2021 that showed that we needed 70 childcare slots in our community, and we currently had 0. So, the definition of a childcare desert. We had incredible feedback from those surveys. Of the 177 families surveyed, 96% reported not having childcare support. Next slide. So we understood that with 76% of families in the district reporting childcare options as unaffordable, not provided as times that were needed, and limiting their job performance, there's a direct tie between household income and access to childcare, cost of childcare. As we know, when we look in healthcare, there are a lot of correlations between household poverty and poor health outcomes. In addition to that, 50% of the children in our community are on free and reduced lunches in the school district. And so it really doesn't even start to kind of cover that need prior to when you get into school. The need for food and resources existed prior to their ability to participate in those programs. And we started kind of seeing the tie to nutrition and health outcomes for these early kiddos. Next slide, please. So I won't obviously read you all of this, but a lot of areas of challenges. Price or cost of care being 15 to 20% of a family's income. Availability, there was no availability in our community. 70 slots needed, 0 filled, 96% of families reporting need for care. 82% of families responding reported that their performance suffered at work. 47% limited their work hours. 25% had to quit their jobs entirely. We knew that there was a health impact that was impacting these families as well. At the time, we had 60% of the children qualifying for free and reduced lunches back in 2020. That's come up a little bit, but nutrition is a huge factor. And then we had all of the challenges everybody's mentioned on here. Community challenge, regulatory challenges. There's a high regulatory burden to operating childcare. Workforce development for childcare workforce. And then, the working connection subsidies really just continue to fall short for a lot of our families. Next slide, please. So we formed a working group. Initially, the health system was just another stakeholder. In that group, we are the largest employer for our community. We wanted to start taking a look at what it would take to bring childcare back into Columbia County. We had Early Childhood Coalition support. We had support from our port, our Chamber of Commerce, and we began looking at, citing a location. This was an election year. And so early on, we partnered with the port, who the port board had agreed to providing green space at a very reasonable cost that we could build a center on. But post-election, we had 2 out of the 3 board members that were replaced. There were a lot of identity politics, and there was not a lot of stomach for municipal organizations supporting childcare in our community. And so ultimately, the port had pulled out of that arrangement. Next slide. We did also start finding ways to fund this project. We reached out to our legislators in the 16th district, as well as our DC legislators, and found really good support broadly amongst all of them. They were wondering how they could lend their support either through commerce grants or federal grants, and so that was encouraging. Next slide. So the important partnership that I had mentioned recognized that the workforce development mission was being impacted. Initially offered an affordable dryland lease. Next slide. Came up with a greenfield design. This was exciting. Started at a $1.6 million budget. Also a phased approach. So we were planning on covering a portion of the need, not the entire need, but build the building in such a way that it would allow for expansion. Next slide. Had a lot of pushback from the community at that point. There was, many of you can remember, pretty tough political time nationwide, but our small community was really in the throes of some interesting dynamics. We had a lot of misconceptions in the community about the project and who was the operator and how municipal funds were going to be used. We held a community forum that was attended by over 70 people, really working hard to sort of dispel some of the misconceptions, but also bring new voices to the table to understand where the community's concerns were. One of the things that kept coming up frequently was there were a lot of empty buildings in town. Is there something that we could do with some of those that would stimulate development on Main Street? A lot of concern about municipal organizations, both the port and the hospital district, operating childcare as government entities. And so really had to work through a lot of those challenges. And one of the things that I want to mention is some of these things seem pretty daunting when you have a group of folks that are saying, we're not really supportive of childcare in this type of fashion at the time when the community had 0 childcare. There were voices at the table of folks that were kind of the mindset that it's not our responsibility to raise other people's children. And we would have been remiss had we not stopped and had those conversations and bring those voices to the table. They were really influential in shifting how we were looking at this project and how we ended up moving forward. And I would say without that heat community conversation, we may not have ended up with the project that we did. And so this wasn't a horrible process, although it didn't feel great at the time. It was really important to engage those voices. Next slide. So the grand tour of available buildings. A lot of caution here. There are always empty buildings in communities, especially rural communities. You look at a greenfield project at 1.6 million, you think surely we could design a project in an existing building for less. A lot of the buildings that we looked at were churches, if you will. Really low price of entry. I think this particular building was around $200,000 to get into it. But when we got through the design and redesign, $1.9 million to redesign this building. Next slide. So this is a little bit about the architectural renderings that we went through. This particular one was not that first church, but the second church, the Methodist church. Again, a church that was actually in better condition, had classrooms set up in it already, but because of needs for access, including elevator, plumbing, fire suppression, the budget was $1.5 million. Next slide, please. So come to find out, childcare regulations require a lot of toilets and sinks. Toilets and sinks are way more expensive than you think that they would be. It's hard to get plumbing where plumbing isn't. It's very costly from access and ADA. Fire suppression is another big one. If you're in a place where kiddos are asleep, you have to be able to offer fire suppression. A lot of these buildings didn't have that existing, and so we would have had to plumb it in. There are requirements for square footage per kid. And so, made sort of rehabbing a building really challenging. Next slide. So the both and solution. We had recently migrated from a nursing home level of care to an assisted living. We had 2 wings in our nursing home, and we had a strategic plan that had a component of it that said redesign hall 2 for something. We didn't know what that something was at the time. Here we are going through all of these tours and buildings, and we'd been working on the childcare project for a little over a year at the coalition. And I remember walking through one of the wings of that hallway with my my facility manager as we talked about opportunities for that. And I was looking up, and there was literally fire suppression every few feet. It was a nursing home, and so there were already hand washing sinks in every room. There were toilets in every room. Most of the rooms had showers. And it was just kind of one of those things that was like, Jesus, it's been under my nose the entire time. Next slide. So this is a layout of the old nursing home. The section in blue is still being used for healthcare services. The section in white was an early rendering of 4,600 square feet that could be repurposed for childcare. The interesting thing about remodeling this space, because a lot of the infrastructure already existed, our price went from millions down to $640,000 budget. Next slide. There is a form for everything. When you're getting commerce or USDA funding, relish in the documentation that you will create, because there will be much of it. It'll make your historic and project look back really easy, because you'll have documented every little detail you can imagine. I think that my project packet just for the USDA federal funding is sitting somewhere around 280 pages right now. We did receive $413,000 from legislature, courtesy of Senator Cantwell's office. They ran those funds through the USDA, and so that meant that the project had to go through the entire USDA process. Washington Commerce contributed $110,000, and then we had a really strong private funding of about $134,000. Next slide, please. Project started, early January 2021. We actually were able to complete the project in 12 of 23, and the center opened in April of 23. Next slide. Sort of wanted to cover a couple of things I think are important to distinguish. It is on campus. A lot of people think that we run the child care center. We don't. We did an RFP for an operator. We recognized pretty quickly that healthcare is highly regulatory, but childcare is probably even more so in some respects. And so we wanted to find an operator who had experience, but we also wanted to find an operator that was currently operating a high quality program. And so we submitted for RFP, so request for proposal or request for qualifications. We did get a highly qualified operator in the form of the YWCA. They were already operating a childcare center in Walla Walla. We selected them as the operator, and so we sort of worked with them as we constructed the space so that they could open it in April. Been an incredible partnership between the two organizations. Some additional challenges, the working connection subsidies, it's interesting, they're by county, which I didn't realize. And for whatever reason, it was determined that Dayton or Columbia County would require less subsidy than Walla Walla County. Even though we're competing for the same workforce, we have the same hourly wage requirements. And so we have only been able to really get about half the center's capacity filled. We're running at about 23, 24 kids right now. It can have up to 42 kids. We do support infant care. It was important to us to be able to do that. And additionally, we did not reserve slots for healthcare workers. Once we dug into this and started realizing the correlation between, really, really good health outcomes and early childhood learning, we wanted this to be a community resource from day one. And so we opened the center on a first come, first serve basis. The subsidies for the working connection, it's frankly limited a lot of capacity. There are a lot of families that are just above the threshold and the cost of care is too expensive for their households. And so while the program is, I would say, partially successful in bringing healthcare or childcare rather back to Columbia County, it is probably not achieving the success that we want. It'll likely be a slow build over time for us. The interesting thing is that the number of infants that we're taking care of is much higher than we'd expected. There's been a lot of need for infant care in the community. Happy to answer any questions from anybody in the audience.
Come on, y'all, don't make me. Oh, yes, Corey.
Go ahead,
Hi,
Cory.
good morning. Thank you all for all your presentations about these great collaborative projects and these facilities opening. And some of the work that I've been involved in up in the North Sound region, one of the challenges too is also meeting the needs for children with special needs. And I guess, with this presentation and I understand that you contracted outside of the hospital, but I just wondered about with the connection to the hospital, if you were able to or found that you had a similar need for families with special needs. Yeah.
I'm so glad you asked that question. We have been looking for ways to enhance the service down there since opening. There is a requirement that you have some sort of nurse overview over kids with special cases. We actually have a pediatrician in our community that we enlisted in this. And so we currently take care of special need kids in that footprint. Pediatrician comes in a couple times a week, checks on those kiddos, helps make sure that program is meeting the needs for the children and the families. In addition to that, we're supplying the meals. Our dietitian that works in the hospital also helped work on the dietary menus for the childcare center. And so we're working hard to satisfy the nutritional needs. We are hopeful that as the project keeps growing, that we're able to accommodate drop-ins. So what we know about moms and dads that are taking care of kids is they often put off their own healthcare because they don't have access to childcare. And so how nice would it be that you could drop your kid off for childcare for an hour or so while you go to your appointment and receive your own healthcare so you don't have to put it off. So we are looking for every way to tie in to the healthcare offerings that we have here at the facility.
That's amazing. That is such a huge need. All of those things you listed. Thank you for working on that.
Yeah. I wanted to touch, I don't know if somebody on this call may already know, but there was a toolkit that was put out recently. Did you guys cover that? You did or didn't? So I'm going to drop a link in the chat. This toolkit was put out by the United Way, and it had some folks from our project that participated on it. Sort of walks through the entire process and things to look for, provides a lot of connections to resources. Our architect that helped us do those facility renderings and early designs, he participated in it as well when trying to create things to look for when you're looking at sites, whether they're existing buildings or new greenfield construction. I found this kit really, really comprehensive and a great place to start for anybody who's looking at this. I don't know if Isla Dawn's on the phone. She's usually on these things, but
She
also a
was, I
massive,
think she did hop off, but I see that they're on there. Yeah, she
yeah,
hopped off just a little bit ago, but I see the Early Learning Coalition on there. This is fantastic toolkit. Thank you.
cannot plug Isla Dawn and her team enough. Truly, truly amazing support.
Shane, I have a question for you. This is Alicia from Pomeroy.
Hi, Alicia.
Hey, so have you all considered or discussed offering sick childcare at all?
Oh yeah. It was built in to the program from the beginning. Um, we we recognize that can be one of the most disruptive things for families is when a child is sick and cannot come in for care. And currently the building is set up in such a way that we could support um, um, kids in a classroom that's empty just for folks that are ill. I think workforce in the childcare center is probably a bigger issue to offering that right now than the center itself. Since we are a healthcare facility, the air exchanges are already meeting the requirements for exchanging air at a rate that supports infectious disease.
Great, thank you.
Thank you so much for your time. I love being able to present on this project. If some of you come up with questions after the fact, I'm going to put my email in the chat. Don't hesitate to reach out. I have written up a couple of small white papers that people have asked about as well, and I've shared those to folks as they've requested them. But I'm happy to walk through this and happy to go participate in your journey as well.
Shane, that was fantastic. Thank you so much. We really, really appreciate it. That was very inspiring and really appreciate you offering to continue to help our communities getting this done. So great work. Fantastic.
Thank you.
Thank you so much, Shane, and to all of our presenters. I will pause if there's anyone has any burning questions for any of our presenters before we fully wrap up today. We'd be happy to facilitate any of those now. Okay, well, we know that the connections built from these conversations are a big part of the benefit. So definitely reach out to those presenters. All of their emails should be included when we send out the follow-up presentation, the slides, and we'll include some of the additional resources, especially that toolkit. We'll be sure to include that on that follow-up email as well. And yes, again, just thank you, presenters. We're so grateful for your knowledge, and we hope that everyone attending will be able to take away some really awesome takeaways for their own involvement in this and their own communities. So we will, in addition to the email going out with the presentation slides attached, I just wanted to make sure everyone was aware that these collaboratives are recorded and we will post it to our website. So if somebody that you're thinking, oh man, so-and-so needs to know all this would be so helpful for them, please do know that that's available down the line as well. So we just want to take a few minutes to invite you to our next collaborative. We always are meeting the third Tuesday of the month from 9 to 11. And next month, we're going to talk about mobile integrated healthcare. So very excited for that topic. It's a program that Greater Health Now supports. We have a couple of programs in our region. We'll hear from some practitioners firsthand. And it's a great just introduction to mobile integrated healthcare. If you're not sure what that is or what all entails, definitely come check it out. So this QR code has the link, and I'll also include the link in a follow-up email as well. And then finally, we do love to receive feedback. So I can put the link in the chat as well. But we would love, we have a post survey. It's pretty brief, just a couple of questions, and also has the option to suggest future topics. So if there's something you'd like to hear us talk about or bring in some experts to talk about, we would love to hear that from you all. And also just hear about your experience today. So One last time, I will just gratefully thank all of our presenters and all of you for being here today and joining us. Let's definitely all get involved in those community collaboratives and continue this conversation. Yeah, we wish you a great rest of your day.
Thanks so much, Danny.
Thanks, Tracy. We appreciate you.
Yep.
Have a good one.
I'm gonna turn off. Bye.
Bye.